And you might have gotten a notification about recording.
hmm
Okay. I okay, it's recording.
Wonderful. All right. Hello, and welcome to the Special Olympics Family Health Forum. We are here today to learn about nutrition as well as diabetes prevention. Specifically, today we're going to talk about healthy eating principles and how those very same guidelines can help support diabetes prevention with tips and advice for the whole family. Um, so I'm looking forward today to sharing my knowledge and advice about healthy eating and information about diabetes prevention. Before we dig in, though, allow me to introduce myself. My name is Doria Bertello, and I'm a registered dietitian in the nutrition department at the Kennedy Krieger Institute. Just to share a little more about myself, I've been a registered dietitian for over 10 years, and I worked at Kennedy Krieger for over 4 years. I've spent over 7 of the last years of my career working with children with special needs. And while my work has mostly been pediatric focused, I've had the privilege of working with a diverse array of people, including kids and adults. My professional experience has taken me across pretty much every level of care, from the hospital setting to rehab and outpatient and beyond. And one of the things that I love most about nutrition is how universally it can change lives. Absolutely everyone is impacted by good nutrition, and we all have the power to improve our lives through food. Let's talk more about that. I also just want to introduce the Family Health Forum a little bit. This is a place where our goal is to reduce the health disparities for people with intellectual disabilities. And to do that, we support the whole family. This space is for families to support each other's health and well-being. And our goal is that together we'll learn about health challenges and how we can work together to stay healthy. So what are we going to get into today? Let's take a look at what we'll be discussing. Today I have 5 objectives that I'd like to review now and that we'll get into more detail about soon. First, we are going to work to understand what healthy eating means in practice. We are also going to explore some approaches to healthy eating at home. And to support this learning, we're also going to review MyPlate, how it can help, and the benefits of having balance within our diets. We're later going to shift our focus to understand some of the risk factors for developing type 2 diabetes. And then finally, we're going to tie together what we've learned about healthy eating to understand how diet can prevent diabetes as well as other chronic health conditions. Before we get into the learning ahead, I'd like to start with a short reflection. Healthy eating can mean a lot of different things to different people. So I want you to ask yourself, what does healthy eating mean to you? There's no right or wrong answer. And I want you to know that ideas about healthy eating can vary because our diets reflect us. They reflect our background, our culture, and our values. So I have another question that I want you to reflect on too. What are some of the biggest challenges related to healthy eating? As we move through today's presentation, I want you to keep these questions and your answers in mind. You may even want to write them down. We're going to return to these questions later, and we'll see if our answers change at all. Now let's get started. Is anyone familiar with MyPlate? Here you can see what's called the MyPlate model. This replaced the old food pyramid, and this is a visual guide for Americans to help support simple, healthy eating that can be used from one meal to another and throughout your whole lifetime. This is an easy way to meet your nutrition needs by following the MyPlate model for your meals. You can see it includes all the food groups, including fruits, vegetables, proteins, grains, and dairy. The food groups are also balanced to provide optimal and adequate nutrition. And I'd like to point out that this model can work for many different diets and age groups and is designed to guide all Americans through their eating. Does anything specific stand out to you as you look at this model? One of the things I like to point out is that half the plate is full of fruits and vegetables. And I want, if you remember anything about my plate, I want you to take that message away, that my plate asks us all to fill half of our plates with fruits and vegetables. All right, now let's dig into healthy eating. What does this mean for us? There's no single answer, but for the sake of today, I've taken this big idea and I've broken healthy eating down into these 8 components or principles that we're going to talk about. Here, you'll see the 8 principles of healthy eating that we're going to discuss today. And I want you to know that each principle is important. And then together, these 8 healthy eating habits can support optimal health as well as disease prevention and can be part of a really important part of a healthy lifestyle. Let's learn more. Let's start with variety. Variety is vital for a healthy diet. We want to spread variety through each of our food groups, including grains, vegetables, fruit, and proteins. And let's remember, every food has a different nutrient profile and offers its own health benefits. Some of us have maybe heard the phrase, eat the rainbow, to encourage us to eat a variety of colorful fruits and vegetables. We should apply this philosophy of diversity to all of our foods, including our grains and proteins. Let's move right along and let's think more about that grains group. The dietary guidelines for Americans recommend that everyone make at least half their grains whole grains. But what are whole grains? Most grains are the seed part of the plant. So whole grains are foods that use that entire seed, which includes, as you can see on the left here, the parts include the bran, the germ, and the endosperm. Now, when we have refined grain products, like the classic example I like to think of is like white bread or Wonder Bread, these refined grain products tend to use the processed grain where only the starchy endosperm is left, which you can see on the left in that second picture. So this is not to say that processed grains are bad, but it does mean that they're missing nutrients that were there before. Whole grains really give us the entire or whole benefit of eating the grain. The bran contributes dietary fiber, which has lots of benefits, ranging from helping with stool quality, promoting bowel regularity, but also things like lowering cholesterol, moderating blood sugar, and supporting optimal health. Fiber is also really important for helping us stay full. And then there's vitamins and minerals in the germ and the bran that are vital for our bodily functions and help support a balanced diet. So, as we think about switching to whole grains, this can certainly feel like a big challenge, especially if we've lived our whole lives eating something different. Lots of us grew up eating refined grain products like white pasta, white bread, white rice. So I want you to think about maybe 1 or 2 of these grain foods that would make the biggest impact in your diet if you were to switch. Try switching just 1 or 2 products at a time. Maybe you tackle bread first or pasta. And maybe there's something that you're not ready to switch yet. Some families even find that a 50-50 blend for something like pasta or rice is a great middle step to switching over to more whole grains. Next, we're going to talk about 5 a day. Most of you have probably heard that phrase, 5 a day, but what does it mean? It's a very simple way to remember the goal for our daily intake of fruits and vegetables. We want to be eating 5 servings per day of fruits and vegetables. Does anyone know how close most Americans get to this goal? No Googling, please. Most Americans only eat about 1 or maybe 2 servings of fruits and vegetables each day. The vast majority of Americans are getting less than half of those amazing colorful nutrients. Now, 5 a day might sound like a lot, but let's think about spreading that 5 a day goal across all 3 of our meals. That makes it a lot easier to achieve, and that just means 1 or 2 fruits and veggies at every meal. When we think back to my plate, that actually fits in really nicely with our other goal of making half of our plate fruits and vegetables. Still not sure where to start though? That's okay. Let's think back to that phrase we just talked about of eating the rainbow. And let's also aim for a wide array of colors as we're hitting our 5 a day. Some of the most nutrient-dense fruits and vegetables are also the most colorful, and these can include foods like berries, leafy green vegetables, and cruciferous vegetables, which are any veggie in the broccoli and cabbage family that tend to have a lot of health benefits. Our next pillar of healthy eating is coming together and eating as a family. Now, listen, life is busy, and I know that, but setting everyone up for success at mealtime starts a long time before the meal. Meals together give families opportunity to talk, to discuss foods, keep the environment very low pressure, and then spark some excitement and curiosity with kids as we talk about different foods. I know schedules can be really busy and complicated, but whenever possible, I encourage you all to sit down and share a meal as a family. I also want to point out that sharing a meal as a family does not necessarily mean that this meal has to be homemade, and it doesn't even have to be at home. But studies have shown us that structured family meal times really benefit everyone in the family. Kids who have the opportunity to have these meals and have dinner with their family every night, they tend to maintain healthier weights. They tend to have higher quality diets, and they tend to do better in school too. So don't forget that meal times are an invaluable chance to talk about the day, to engage with kids about food, and to model healthy habits for the whole family. Now, I can't talk about nutrition and about healthy diets without talking about balance. Balance is such an important pillar of healthy eating. Simply put, this just means not eating too much or too little of any one food or group of foods. Research has found that excessively restrictive diets are really unsustainable, meaning we can't keep them up over a long period of time. And we know that eating is sometimes about more than nutrition. We eat for so many different reasons. Some of them are social reasons, some of them are cultural reasons or personal reasons. And we need to remember that there are no good or bad foods. I encourage everyone to think about foods more in terms of frequency and the balance that comes with that. So, in order to get the variety that we aspire to, we have to make room for every food by moderating or balancing our consumption. Some foods might be an everyday food that we really do need and want every day. But there are other foods that might be sometimes foods that we don't need in our daily diets for our health, but we might enjoy them regularly. And there are still other foods, especially those with these nutrients that are really high in the American diet, nutrients like added sugar and salt and saturated fat. These foods may be more occasional foods that we enjoy, but less frequently, such as on special occasions. There are a lot of people who think that the trick to healthy eating is just to swear off junk food, not think about it, not crave it, not eat it. But instead, I want you to try to think about your favorite junk food the same way you'd think about birthday cake. This is something delicious and it's something special. It's just not meant for every day. Now, there's another topic in healthy eating that is actually more about drinking, and that is hydration. And I can't talk about healthy eating without diving into hydration. Beverages are actually an essential part of not just hydration, but our health. So we always want to start with water when we're talking about hydration. We want to have water available all throughout the day for different members of the family. And this should be the primary source of hydration for all of us. When picking other beverages, we want to think about a few things. For the most part, we want beverages that don't have a lot of ingredients or a very short list of ingredients. We want low or no extra calories because most of us don't want to be drinking a lot of sugar, for example. We'd prefer no added sweeteners, no artificial sweeteners, and if there are calories in our drink, we'd like a high nutritional value. And what do I mean by that? maybe some protein, vitamins, minerals. Now, there are some drinks that we should really limit and save them as special occasion drinks. These are things like sodas and other sugar sweetened drinks. This could also be drinks with a long list of ingredients. Some folks prefer to avoid caffeinated drinks as well. For the most part, kids and adults in the US get plenty of added sugar in their diets, so we don't need to be adding more through our beverages. Um, some drinks do contain sugar, but offer more health benefits, like a chocolate milk, whereas something like a cola might offer sugar without the health benefits. Another tricky category of beverages is 100% fruit juices and sports drinks. These I would put in sort of the middle category, which is to limit them, but we don't need to entirely avoid them. If you're thinking about having a fruit juice, I want you to ask yourself if maybe you'd want to have the fruit itself. Having the whole fruit instead of a fruit juice offers the same flavor with more fiber and nutrients than the juice would. Um, Sports drinks are another interesting category. Sports drinks and electrolyte beverages. They can be really vital for athletes and also when the weather's hot, just to keep us feeling hydrated. Um, but these can also contribute some more sugar and some more sodium than we might need on a day-to-day basis. Other calorie-containing drinks might include things like milk, whether that's dairy or plant milk, that are low in sugar and high in nutritional value, and these can be an important part of a balanced diet. However, what I want you to take away is that water should always be our first choice for hydration, no matter what. Moving right along to our next principle of healthy eating is to share. Now, I've said this already, but I'll say it again. Eating is about a lot more than nutrition and calories and protein. Eating is social, it fosters connection, and it draws us into one of the most important parts of our day. Now, kids learn a lot about eating from parents and other adults. And we know that kids watch how the adults in their lives eat at mealtime. So this is a great opportunity to model the eating behaviors we want to see in our kids. It's also a really great opportunity to involve kids in meal planning and meal preparation. Now, this could be talking about the meal, picking out a recipe, going shopping, starting a garden. There's so many ways to involve kids in meal preparation and planning. Find the one that works best for you and your family. Now, let's talk about budget because this is an equally vital pillar of healthy eating. I know for some of you, the first things you hear when the phrase healthy eating comes up is, well, that sounds expensive. I'm here to tell you that healthy eating does not need to be any more expensive than your usual diet. There are some simple ways we can help keep overall food costs down. And these can include tricks like cooking at home more. We know that when we cook at home, we have the most control over the ingredients, the preparation method, the quality, but also the budget. We know that cooking at home is the least expensive way to hit our nutrition goals. And we also know that eating at home can yield a more nutritious meal for the family. Another option to manage budget when it comes to food is to replace some of the animal protein in our diet with plant-based proteins. In addition to being cost effective, these plant-based proteins can be a really healthy addition to your diet. Other strategies can include planning meals in advance, because we know that when we're making last-minute meal decisions, we'll often have to opt for the thing that's easiest rather than the thing that's most budget-friendly. With a little advanced planning, though, we can select a recipe ahead of time, shop for exactly what we need, plan the time to cook, and then we can save on some of those expensive convenience ingredients. Oops. Um, Another strategy that goes right alongside that is to help think about minimizing food waste. So planning helps us accomplish this as well. by thinking ahead, buying only what we know we're going to cook, uh, by following good food safety guidelines for all of our food to prevent any waste. We can help make sure that the food we're buying is not ending up in the trash, but is nourishing us all. Um, Yet another option to think about when we're thinking about budget is purchasing some of our shelf-stable pantry staples in bulk. This might include foods like grains, beans, cereals, baking essentials, and more. And you'll see on the bottom right here, there is a QR code. If you'd like any more information about eating on a budget or any food insecurity resources, please visit the QR code for more information. Please excuse me. Okay. We've now made it through the 8 healthy eating principles. You'll see them here. We just reviewed all of these, just to remind everyone that each of these is equally important and each of these contributes to healthy eating. Now, keeping these in mind, we're going to shift gears a little. We're back to my plate. You may recognize this from earlier, but I want you to think about my plate a little differently now. I want you to think about the last meal you ate. Maybe it was your breakfast, maybe it was dinner last night. And as we digest some of this information about healthy eating, I want you to thinking about that last meal. Did we have foods that fit in every category? Which foods fit into which category? And as you think about that, trying to remember what you ate, do you notice any gaps in your plate? So, as we integrate and start to practice these healthy eating principles, I want us to also start to understand that these strategies for healthy eating are the exact same strategies that lay out the roadmap for a diabetes prevention diet. In other words, the best diet for preventing type 2 diabetes is the same type of diet that we just discussed. It follows the same principles. But what I want to talk about even more is beyond diet, what are some of the healthy lifestyle and other practices that help us achieve diabetes prevention? So let's dive into that. So moving past diet, we know that diet impacts our diabetes risk, but what else impacts our risk of developing type 2 diabetes? Through wise choices of both in terms of our diet and elsewhere, we can develop these lifelong habits and really channel the power of nutrition to minimize diabetes risk. But we need to know what our risk is and what other factors contribute to that risk. So we're going to talk briefly about some of those other factors. And did you know that things like age, gender, family history, blood pressure, physical activity, race, and weight all contribute to your risk? Let's talk more about it. Before we get started on the specifics, I really want to encourage you all to use the link here or the QR code to visit the American Diabetes Association, also known as ADA's, diabetes risk test. This is about 10 simple questions that you can click through, and once you finish answering them, it'll give you a score, and it helps you better understand your diabetes risk today, and it's something you can check down the road if other factors change. Now, I want to talk a little more about those non-diet diabetes risk factors. Let's start with age. So as all of us get older, our diabetes risk increases over time. One of the best ways to monitor our overall health as well as our diabetes risk is scheduling annual physicals with your primary care doctor. We also want to think about our family history. We know that this impacts our diabetes risk. Now, if you have a parent or a sibling or another close relative that has diabetes, you are at an increased risk of developing diabetes yourself. So it's really important to learn your family history share it with your doctor, and stay up to date with your doctor. Some other factors that impact diabetes risk, as we mentioned before, include gender, blood pressure, and weight. Now, according to the American Diabetes Association, men are statistically more likely to have diabetes and not know it. So once again, it's very important to make sure we see our doctor and follow up with any screenings or tests they recommend. We also know that having high blood pressure puts us at higher risk of developing type 2 diabetes. This is another thing that our doctors can monitor and help us manage if it's a problem that we're having. And while we know that all bodies are different, research has shown us that people who are overweight or obese are at an increased risk of developing diabetes as well. Keep in mind that weight and BMI are just one measure of health, and some people have higher BMIs, but they might be healthy, active, and muscular. But when physical inactivity leads to unintended weight gain, we know that weight gain also increases our risk of diabetes. You can always talk to your doctor, your healthcare team, and or your dietitian about your blood pressure, your weight status, and what more we can do to decrease our risk. Finally, research has also shown us that people from certain racial groups are more likely to develop diabetes. Once again, your doctor can help track your risk and make sure that you're on track to stay as healthy as possible. Finally, last but not least, we know that staying physically active throughout our whole lives plays a huge role in maintaining our overall health, but also in keeping our diabetes risk down. Staying active as we get older can be really challenging. We should all stay moving throughout our lives, though. As simple as it sounds, I suggest try to find movement or activity that you enjoy. Physical activity is going to feel more fun and less like work if it's something that we already like. Another thing that works for a lot of people is getting active as a whole family. This is a great habit to start and keep going, and it's a wonderful opportunity to spend time together. Some other people like getting moving with a friend, going to a fitness class, or even meeting up with a bigger group. The most important thing is just keep moving. So we've talked about a lot of different ideas and strategies today. So how can we bundle this all up and take it home? So here's what I'd like you to walk away with today. First, I want everyone to eat more fruits and vegetables. I want you all to eat a rainbow of colors. I want you to fill half your plates with fruits and vegetables, and I want you to do your absolute best to get 5 servings a day. I also want you to balance your choices and opt for variety whenever you can. Now, that balance is making sure we're not doing too much or too little of anything. And that variety is where we get just that really wonderful, diverse assortment of nutrients, of different colors and flavors and textures. I want you all to think about my plate when we're planning meals. Now, whether that's planning something as simple as what to put on your sandwich, or maybe planning a meal that's going to feed the whole family, think about my plate as we balance what is in that meal. And then knowing that the American diet is very high in added sugar and sodium, I want you all to use some of the strategies we've talked about today, including balance, including our beverage choices, to limit the amount of added sugar and sodium we are including every day. As much as possible, eat meals together as a family and model healthy eating for the younger folks in our lives. Whenever possible, involve family members, especially kids, in all aspects of food preparation, cooking, and teach them to have this healthy, balanced relationship with food and eating. I want you all to stay active and keep moving in a way that you find enjoyable and does not feel like hard work. And then please schedule regular checkups with your doctor, share your family history, talk about your risk, and ask what, if any, tests or screenings you might need. So we're going to wrap up with a reflection that kind of brings us back to the beginning. We've learned a lot of different things about healthy eating today, and some of them are probably things you've heard before. But I'm guessing some of them might be things you haven't heard before, maybe haven't heard in this context. So again, healthy eating means different things to different people. But I want you to think again what healthy eating means to you. And again, there's no right or wrong answer. But has this answer changed for you over the course of this presentation? And similarly, I want you to think about what are the biggest challenges to healthy eating for you. Has this answer changed for you over the course of the presentation? Or are there other things you're considering now? Think about this and please compare your answers to, if you wrote them down, compare them to how you answered earlier and see if there's any difference. If there are any questions, please direct them. I'd be happy to answer them remotely. Which brings me to contact information. I want to thank you so much for joining me today and taking the time to hear the information I had to share. I really love talking to kids and families about healthy eating and how we can really leverage the power of food and nutrition to feel our best and be our best selves. Please do not hesitate to contact the nutrition department at Kennedy Krieger with any questions. You'll see here, this is the phone number and also our web address. So thank you very much. Reach out if you need anything, and bon appetit, everyone.